Hi, everyone. I think we have all our speakers here and a couple of people tuning in, so I'll get started. I want to welcome everyone back to Advocacy in Action. This is a series of conversations that takes listeners behind the scenes of advocacy campaigns that save lives. My name is Mena El-Turky. I'm with the Global Health Advocacy Incubator, and I'll be your host. In this edition, we are going to be diving deeper into a topic we've all become quite too familiar with, pandemics. We've all been living through a pandemic for the past 2 years, and we're going to be talking to individuals who are on the front lines of the advocacy that goes into preventing pandemics around the world. In preventing pandemics, including future pandemics. We are joined today, I'm super excited, we are joined today by 4 expert guests who are advocating on a global and country level to build political will, to prioritize funding dedicated to preventing epidemics, and be better prepared in the face of future threats to health security. Today, we're going to hear from Carolyn Reynolds, the co-founder of the Pandemic Action Network, my colleagues Anne Danelski and Dr. Emmanuel Alhassan, as well as Dr. Gafar Alawode, member of the board for the Legislative Initiative for Sustainable Development. So I'd like to just welcome everyone and welcome all the new listeners. My first couple of questions will be for Carolyn Reynolds, who, like I said, is the co-founder of the Pandemic Action Network and a global health development and U.S. foreign policy leader with over 30 years of experience. She's a global health policy senior associate at the Center for Strategic International Studies, an expert advisor to the Commission on Strengthening America's Health Security, and she served as a senior advisor to international organizations, including Global Financing Facility, the World Bank, the World Health Organization, and Global Preparedness Monitoring Board. Carolyn, welcome. Carolyn?
Oh. There we go. Okay,
there I think you are.
Now. Hi, thanks, Nana, and great to be with you all.
Yeah, so great to have you here. So I'll jump right in. So first question, why did you start the Pandemic Action Network, and what are some of its major accomplishments so far?
Well, thanks. And I'm really glad that you're having this conversation. It's so important now more than ever. Look, long before we had COVID, really over the past 2 decades, the world has been ignoring these growing epidemic and pandemic threats, despite lots of warning signals. We had SARS 20 years ago, we had H1N1, we had Ebola about 6-7 years ago, Zika, MERS. We've had a lot of epidemics and potential pandemics over these past 2 decades. And each time, after each one of these crises, there's been expert commissions that have been convened, reports have been written on what went wrong, recommendations produced on how to prevent this from happening again, and warnings that this will happen again if we don't take action. But the vast majority of those recommendations, however, have not been implemented. It's not been a priority for governments or international institutions. We talk about the cycle of panic and neglect in this field, or crisis and complacency, which continues to repeat itself. There's an outbreak, there's a health crisis, everybody rushes to deal with it, and then the threat dissipates, and then it's out of sight, out of mind, and we turn to other issues, and we don't solve that and those underlying needs around making sure countries are prepared to detect, prevent, and respond to outbreaks so that this doesn't keep happening. So the real issue has been not a lack of ideas or knowing what to do, but really sufficient and sustained political will and investment in pandemic preparedness. So actually, back in 2018, a small group of us, I was vice president for policy and advocacy at PATH. After many years at the World Bank, I worked at the World Bank during the Ebola crisis, so I was deeply involved in that response. And a group of us started meeting. We really determined to change this dynamic, but it was really a labor of love. We didn't have any money to get this network started until early 2020, April 2020. Actually, this week marks our second anniversary of setting up the Pandemic Action Network. So we're just a little bit younger than the pandemic itself. But we finally had the opportunity to stand up Pandemic Action Network. We're a global advocacy platform with a very focused mission, and it's to stop this pandemic and prevent the next one. And so over the past couple of years, we've really grown into a diverse network of more than 250 partners around the globe. We're continuing to grow. We provide a platform for our partners across geographies, across sectors to connect, share what they're learning, sharing what they're doing, collaborating, forming partnerships, supporting them in their work, and also catalyzing collective action on these really tough issues that really demand a collective force. So our unique value as Pandemic Action Network is that what's been missing is, again, not the health expertise, not the ideas, not the technical know-how, but the strategic communications, the advocacy, the policy expertise to really mobilize and build and sustain the political will.
Thank you so much. That's super amazing, and that this Pandemic Action Network just started in the past 2 years, just alongside the pandemic itself. I love what you said about the crisis and complacency, which we see in a lot of our public health issues. But of course, this is exacerbated because the crises are so destructive. So speaking of COVID has affected everyone's life, and it's really shown us what happens when pandemic preparedness is neglected. So what do you think are the biggest challenges we still face in responding to the next pandemic?
Well, maybe before I answer that, let me just give you a little flavor for what we've been doing over these past 2 years, because and that sort of gets to the challenges that we're facing today. So over these past 2 years, as I said, we've created this platform for partners working on both the COVID response and on pandemic preparedness to come together and meet. We have these working groups that are really the meat of our action, places to learn, share, align, strategize. On the COVID response, we feel like we've had a really important role in pushing political leaders to expand equitable and affordable access to COVID tools, to tests, treatments, vaccines, PPE, oxygen to save lives, on mobilizing resources around the structures that support that, what's something that's called the Action for COVID Tools Accelerator. That's a multilateral initiative. Engaging with G7, G20 leaders really around the world to get this higher on the political agenda. And we were really instrumental in pushing the U.S. government to host last fall a global COVID-19 summit to get really where we saw a real lack of leadership globally on the pandemic, to get the White House to bring leaders together and focus on the challenges remaining on the pandemic. And they've just announced they'll be hosting a second summit in a few weeks' time. So we've been sort of mobilizing calls to action in the lead up to those moments. On pandemic preparedness, we've been really identifying what are those key gaps, from surveillance to access, better, faster access to research and development, but also delivery of those tools, working to inform leaders on some of the things that are most needed, and really building that constituency for pandemic preparedness and response. So, but what challenges, to your question, that we face today as we're, still in a pandemic, right? We're not out of this. And that's challenge number one. There's pandemic fatigue. Leaders and publics, all of us, right? We're taking off our masks. We're going back to normal. We're turning away from this pandemic, even though it's still very much with us. And so we do that at our peril. We can't live, continually in lockdown mode, but we do have to. This is an important time to be making sure we are making the right, putting in place the right policies and the right investments to deal with whatever next iteration of this pandemic may come, because there will be likely future surges in different places around the globe. We're seeing it happen right now with the new Omicron variant, but also to prepare what might be the next pandemic lurking around the corner. And it's really tough, right? Because there's all these other crises that are happening in the world. There's the war in Ukraine, there's the global food security crisis, there's climate change. So it's really tough to keep folks focused on the threat in front of us. And so in a way, our work becomes even more important and more challenging today than it ever has been. We're also dealing with this challenge that this is pandemics, epidemics are both, we feel them at the local level. They have to be managed at the local level, but they also are dealt with by national governments, but they are global collective security challenges. And yet we saw in this pandemic, unfortunately, too much of countries focusing inward, governments focusing inward towards their own people and populations, rightly so, but we can't solve this unless we solve it as a global community. Viruses don't know borders. So we have to solve these as a global system, and we have to have those global systems better strengthened. Health systems everywhere, rich and poor countries, are stressed, are broken. Healthcare workers have been leaving in droves, have been, on the front lines impacted by this. There's been competition for too little money, across for what's needed. And I would also say that pandemics are still seen too much as health threats rather than really fundamental systemic threats to our security, to our economy, to our livelihoods. And we've seen how much damage this pandemic has wrought on, people's jobs and livelihoods and well-being, but we still put them kind of in that health box, and we have to change that in terms of how they're treated as political priorities. So I would say that, but it's not all glum. We have, I think the fact is pandemics are no longer abstract for most people. Almost everyone has had a lived experience with this. And so there are both lessons we knew before COVID, but also very much reaffirmed about why pandemic preparedness is such a key investment. And also we've seen incredible ingenuity, right? Incredible advancements in science to develop vaccines so quickly. But we have to work on those systems of how do we make sure all of those opportunities, for example, on getting vaccines developed quickly, that everybody has equal access to that, no matter where you live. So what we're focusing on this year is really to work on those systems, making sure the world at every level has those resilient, ready ecosystems. We've got more financing and sustainable financing in place to deal with it, and that we're also creating a better, more accountable system so that leaders are held accountable for making this happen. And that means we need more advocates, including those of you in the room, to really carry this forward in your communities and in your countries.
Thank you so much, Carolyn. You said so many great things. I was trying to write it all down, but that the viruses don't know borders, that, health security isn't just about health, just like public health isn't about health. It's about livelihoods. It's about just everyday living, and that understanding that a pandemic isn't just a threat to health, it's a threat to so many other sectors, and just building that multi-sector approach. And just, what you also said about it's not really abstract anymore. So on one hand, there is that fatigue that is there after 2 years of experience the pandemic. And then on the other hand, now moving forward, advocacy can be framed in something people understand when we're talking to those leaders.
Absolutely.
Right. Thank you so much, Carolyn. I'm going to shift gears a little bit and move from the global perspective, but stay online because we'll come back to you towards the end. From the global perspective to more of the country level work. The country level advocacy efforts. So my next few questions will be for my colleague, Anne Danelski, who is the program lead for the Global Health Advocacy Incubator's Prevent Epidemics program and the Nigeria Cardiovascular Health program. She's based in Washington, D.C. and brings more than 15 years of experience in domestic international health policy and advocacy with a focus on increasing access to healthcare coverage in infectious disease. Anne, welcome.
Hi, Mena, and thank you so much for moderating this discussion today. And thanks to Carolyn for her great statements. And she's very accurate that the cycle of action to inaction is one we've seen again and again, and we need to combat that. So I'll start with an overview of the Prevent Epidemics program to provide some context for our work. The GHI's Prevent Epidemics program was designed to build public and political support for domestic investments in epidemic preparedness and to generate the political will that is needed to support new and sustained funding. The program started in Nigeria and Senegal in 2018, well before the current pandemic, and continues today in Nigeria and Ghana. The PE program strives to address the challenge many countries face financing implementation of their national action plans for health security that are designed to build IHR capacities. Funding for national action plan implementation is a common challenge throughout many countries because funding for preparedness, as Carolyn mentioned, often takes a back seat to competing country priorities that present with greater urgency at the time. To address this, GHAI provides our partners with legal, research, and communications technical assistance to identify opportunities for funding and to develop strategies to increase public and political support for the funding. This is done through locally led advocacy campaigns based on coalition building, policymaker engagement, and a comprehensive media strategy. For an example from Nigeria, when the Nigeria Center for Disease Control was established, GHI and our partners helped to identify funding pathways for the new agency and to build public and political support for the funding increases. With that, NCDC gained support and funding for the new agency that has been ongoing since 2019 and has more than doubled to date. GHA's partners had similar successes at the state level in Kano and Lagos, where our partners identified an advocacy opportunity and successfully generated support for a new budget line in each state to support epidemic preparedness and response. GHAI's advocacy in Nigeria is led by the Legislative Initiative for Sustainable Development, known as LISDEL, with Nigeria Health Watch and Budget, and is part of a partnership with Resolve to Save Lives and their Prevent Epidemics program. With successful budget increases in Nigeria, we are now also focusing on greater accountability and budgeting as the next phase of the campaign. But I'll stop here so that others on the panel can speak in greater detail about our work in Nigeria, since we have LISDEL and our in-country coordinator present. Thank you, Mena.
Thank you, Anne. Before I move on to talk more about focusing on Nigeria, Carolyn talked a lot about the need for advocacy on a global level and the fact that viruses don't know borders, and so it needs to be a collective effort. But can you talk to us a little bit about why is country level advocacy for these issues so important?
Yeah, no, I think country level advocacy is key and a great starting point for the global advocacy. Country-led advocacy links the campaign to the local context and priorities and helps to generate effective messaging that will resonate with the public and decision makers in government. And being able to develop that messaging is very important to move the policy forward. Country-led advocacy is also important because it builds lasting relationships with government and other stakeholders. As part of an advocacy community for health and health security, country-based constituencies and campaign leaders are more likely to remain invested in the policy and advocacy goals beyond the life of the Prevent Epidemics program. I believe that this extends the longevity of program goals and support for health security funding generally, and increases and sustains program impact beyond the life of our program. Mena?
Yeah. Thank you so much. So then let's go ahead and dive deeper into that country level work. So thank you, Anne. I'll jump over to Dr. Emmanuel Alhassan, who is the Nigeria coordinator for the Prevent Epidemics program and works with several stakeholders to advocate for improved and sustainable funding for epidemic preparedness and other policies related to health security. Dr. Emmanuel, welcome. Doctor? Oh, I think there you are.
Thank you, Mena.
Oh,
thank you, Mena. Can you hear me now?
I can. Thank you so much for joining us. I know Anne had just mentioned that Nigeria doubled funding for the Center for Disease Control the Center for Disease Control in Nigeria over the past 2 years. So can you tell us a little bit more about what the role of civil society had in making this happen?
Thank you very much, Mena. I think Anne has eloquently provided us with the background of the campaign here in Nigeria. Civil society organizations worked with GHAI to, among other things, one, conduct a political mapping, a legal landscape analysis, and a strategy for building the case for increased investments in epidemic preparedness. Secondly, they also worked with us to conduct a comprehensive media campaign to increase awareness of epidemic preparedness and make the case for the need to increase funding for the Nigeria Center for Disease Control, NCDC, and other health security related agencies. Furthermore, there has been continuous engagement with relevant lawmakers in the Senate and the House of Representatives through various advocacy mechanisms, such as policy briefs, policy dialogues, breakfast meetings, field trips, and webinars to ensure progressive incremental appropriations for health security. It's instructive to note that COVID came into Nigeria exactly a week after the senators who are advocate champions, as well as House of Reps members, actually visited the biggest port of entry to Nigeria. That's the international airport in Lagos, to look at the state of preparedness. That was really instructive. COVID, the first case, came in through that particular airport a week after that visit. Then number four, civil society organizations have also worked with GHI to build a working relationship with the Federal Ministry of Finance, Budget and National Planning for the relevant officials to better understand the need to prioritize NCDC's budget requests. So these are some of the key things that the civil society organizations have done in contributing to the success of our campaign. Over to you, Mena. Hi, Mena.
Sorry, I'm here. So I have just one follow-up question. Thank you so much for going through the role of civil society. So after Nigeria doubled the funding for its Center for Disease Control, what role does civil society play in how that funding is used? Is that still part of the conversation? How does that work move forward?
Absolutely. So in terms of the release of the funds, because it's one thing to have the appropriation, second thing to follow up to ensure that the funds are released, and thirdly, to ensure that they are used in a transparent manner. And so we've been working with LISDEL and the other partners who are the grantees on this program in Nigeria to ensure that there is accountability. And in that regard, we have worked together to produce what we call the Health Security Accountability Framework. This framework is very important because it tracks how these monies appropriated are spent. And even though there are lots of challenges getting the appropriate data, particularly when you go into the various thematic areas, and also looking at the activities that have been carried out by all these agencies, we have been able to get some data, and we are currently working with the civil society organizations to ensure that we populate that framework, analyze how effectively these funds have been spent, and very soon also disseminate those findings. Over.
Thank you. Thank you. I think one of the biggest challenges in advocacy that we face is sometimes we get the funding and the budget set, but then, how it's spent is a whole nother advocacy campaign and challenge. So I totally understand how difficult and challenging this work can be. The last question I have for you is more just about advocacy in this work. What makes advocacy successful, and what have you learned? What are the biggest lessons you've learned along the way throughout this process?
Thank you, Mena. Quite a number of lessons, and I'd like to speak to a few of these lessons. Anne has already spoken to the issue of understanding the local landscape. It is very important, especially the political economy, the cultural nuances, and an appreciation of the relevant levers to pull in the cause of advocating for increased funding for health security. Another key factor is partnerships. And these other things work hand in hand with that. Partnerships, connections, effective coalitions, and networks. All these are very key in ensuring that you have a successful advocacy. A third lesson is that it's important to adopt a multi-sectoral approach to include non-health security actors. For instance, in Nigeria, we work very closely with the Federal Ministry of Finance, Budget and National Planning, and we have also had to engage with the budget drafters in the various ministries, departments, and agencies that have a role, one role or the other, to play in ensuring that we have health security in Nigeria. This is in addition to the NAPS focal persons who ordinarily are supposed to be a bit more versed in the area of health security. So a multi-sectoral approach is very, very important. And then an understanding of budget processes in country, the key gatekeepers, key influencers, and critical decision points would help those involved in advocacy to help focus their efforts. And finally, I must also state that even though it is desirable to work on quick wins, very, very important, very, very desirable, it is important to note that advocacy is a marathon and not a sprint. Over, Mena.
Thank you. Thank you. No, you said two things in there that really spoke to me. One was the last piece about the quick wins. And when I'm thinking about advocacy in any sector, those quick wins, they're helpful, that they build momentum for that marathon. Along the way, having a win here and there can keep the journey going. So I thought that was really beautifully said. And then also what you said about the multi-sector approach back, what Carolyn was talking about, that this isn't just a health issue, that it is a larger issue, needs a multi-sectoral approach, and there's no shortage of health experts, but understand how to approach all these different processes, all these partnerships is a whole other skill set that needs to be taken on. So it's just why the advocacy is so critical. Thank you so much, Dr. Emmanuel. It was great talking to you. I'm gonna jump over to dive even deeper into the state level work, which I'll have a few questions for Dr. Gafar Alawode, who is a public health practitioner and experienced program manager based in Abuja, Nigeria. He serves on the board of the Legislative Initiative for Sustainable Development, which is a nonprofit organization committed to improving the lives of Nigerians. Welcome, Dr. Gafar. It's great to have you here.
Thank you very much, Mena.
So can you tell us a little bit about the work that the Legislative Initiative for Sustainable Development does to increase political will for epidemic preparedness, and why it's important?
Okay, thank you very much, Mena, and thanks to others for listening to us. So the project that LISDEL implements is a Prevent Epidemics project, which is geared towards repositioning the policy, institutional, and financial framework and build political support for epidemic preparedness and response in Nigeria. So we work in 3 locations: at the national level in Nigeria, and in 3 states, namely Lagos and Kano State, which happens to be the two most populous states in Nigeria. So in terms of how we did our work, the first thing we actually did in each of these locations is to understand the landscape in terms of what are the problems with regards to policy and financing and institutional arrangement for epidemic preparedness and response, and to understand what are the gaps in financing, what are the gaps in policy, what is the level of political support that health security enjoy in each of these three locations, and then to understand the systems generally, including the public financial management arrangements, and at the same time to identify actors and individuals that play a very, very important role in terms of policy making, in terms of law making, in terms of financing, and then the influence and interest of such policy makers. So after understanding the landscape, we now have a clear understanding of the problem that we really want to solve. So that helps us to develop our intervention plan, which include how do we build capacity, because part of what we did at the initial stage is to build capacity of a wide array of our stakeholders about what is epidemic preparedness and response, what are the policy issues around these, letting them know that there's a national action plan on health security. And at the same time, to look at the gaps that we identify in our assessment, to look at how do we do advocacy to bridge in this gap. For example, where there is no budget line for health security, how do we advocate to the wide area of stakeholders so that the Ministry of Health create the budget line, they are supported by the legislature, and the Ministry of Finance is able to allocate money for that, especially take for instance in Kano, when we got there, there was no budget line for health security, so we had to do a series of advocacy. And again, we put together a multi-sectorial structure where the civil society interface with Ministry of Finance, interface with Ministry of Health, representative of a governor's office in some cases, so that where we are able to present the findings in terms of gap to them, and to bring to the notice of the stakeholders how to solve the problem address. Another important component of the intervention is the accountability bar, that accountability framework for health security financing that we're able to deploy. We work with other coalition of health sector, other coalition health sector reform to build on the health finance and accountability framework which they've already developed, to develop a very robust health security finance and accountability framework, which include indicators on financing in terms of what is allocated, what is released, what is the money utilized for. But more importantly, in terms of action, what are the roles and responsibilities of policymakers, lawmakers, and the media in terms of utilizing information. So if there is increased transparency, we know what is happening, what are the stakeholders using that for. So we're able to deploy those accountability framework at the national level and the state level to ensure that there is increased, there is budget line where there is no budget line before, where there was no budget line before, to ensure that money is allocated, to ensure money is released and money is utilized for the intended purposes. But it's not only about financings as well. We work in the area of the policy framework to ensure there is a necessary legal framework for backing the health security. In Kano and Lagos State, we work in this area as well to ensure there are necessary health security legal framework. Even at the national level, we look at a relevant legal framework and we play a very, very active role in that area as well. And then we try as much as possible to document what are the lessons that we've learned in various locations. Like I said, we work in 2 states, and there are 36 states in Nigeria. So we have documented lessons learned in terms of the approach, in terms of the result, in terms of the challenges, and then use that lessons learned to engage stakeholders in other states, and using that umbrella forum that can ensure that we replicate those findings. So that's an overview of what we have done so far, Mena.
Thank you so much. You really touched upon the importance of connecting that state level work to the national level, and then also to the which is connected to the global level, and also identifying how necessary transparency is. So activating civil society and media to really build that transparency, which I can show and reveal the gaps, and also have a space for accountability. So since Nigeria you were talking about the successes that you've had in Nigeria for the health budgets at the state level. Can you talk a little bit about, what are those health security budgets used for? So some of the activities that those budgets would be used for in the form of preventing epidemics or preparing for epidemics.
Okay, quickly. So before talking about what the budget lines are used for, so some of these activities that we embarked upon actually led to some specific results in terms of creation of a budget line, new budget line in a place like Kano and Lagos State, and ensuring that that budget line actually funded in both Lagos State and in Kano, and ensuring that the existing budget line, especially at the national level for NCDC, there is an improvement which we have talked about in terms of doubling the expenditure. It led to that. And again, there's a specific earmark fund for health in Nigeria, and part of it is dedicated to health security, and that is basic care provision fund. At a point, health security was actually taken out of the basic care provision fund, and this effort led to reintroduction of basic care provision fund in those areas. So in terms of what the funds actually are used for, so the funds are used for a wide array of activities ranging from preparedness and response as well. It will be interesting to let you know that in Nigeria at the national level, there's a national action plan on health security, which details the activities in terms of preventive and curative, even the regulatory functions that need to improve before we are able to get a better score in health security. So these are, especially at the national level, these the annual budgeting for health security is actually guided by this National Action Plan on Health Security. And one other area where the project has actually helped is that because the National Action Plan on Health Security is a multi-sectorial plan, because there are a lot of ministries and agencies outside the health ministry that have a lot of roles to play. So at the initial stage, the NCDC was actually being prioritized, and other non-Ministry of Health implementers were not being prioritized. So what we actually did is to ensure, working with other implementers, to ensure that other important activities outside the health sector, like Ministry of Agriculture, like the port health services, like the National Nuclear Regulatory Agency's activities, they are actually prioritized in the National Action Plan on Health Security, and they were budgeted for, and we did advocacy to ensure that those activities that were budgeted for were actually protected in the budget. We will continue to use the accountability framework to ensure that the funds are released and utilized. And the accountability framework actually include the key results that we are going to look at. And again, probably the overarching results that Nigeria is looking for is improvement in the joint external evaluation score of Nigeria, which currently stands at like 46% from previously 39%. And we hope that with consistent implementation and advocacy, we're going to have a higher joint external evaluation score. Over.
Thank you so much. This was just a wonderful example of the need and the success of state level advocacy work and connecting that state to the national level, and also the use of frameworks. I've heard Dr. Emmanuel and Dr. Gafar both talk about frameworks and how it can create the path forward. It doesn't have to be a perfect fit everywhere, but at least it creates some sort of guidance or path for the future as well. Thank you so much, Dr. Gafar, for sharing that experience. We have a couple minutes left, so I have one last closing question for actually all the panelists. So in 60 seconds, or less, if there's one thing that you'd want our listeners to leave with today, what would it be in terms of epidemic preparedness, pandemic preparedness, and prevention? Carolyn, I'll start with you.
What's the one thing we should do? I think we have a real opportunity finally to begin to mobilize. It's not going to be the end, but begin to mobilize additional financing to help countries begin to close their critical gaps on epidemic and pandemic preparedness. And there's a proposal moving through to create a new fund for global health security and pandemic preparedness that would move in that direction. The U.S. has already pledged a significant amount of money towards that. Other countries are looking at this. In fact, G20 finance ministers are meeting and health ministers are meeting today to discuss it alongside the World Bank meeting. So it's not the only thing we have to do, but it would be a really critical first step to get a fund that is dedicated towards managing these threats and mobilize more support for countries for closing preparedness gaps at national, at regional, and at global level. So I hope that's one thing we could really mobilize advocates around.
Thank you, Carolyn. I'm sorry, Carolyn. And Anne, one thing you'd want the audience to leave with today?
Thank you. Yeah, no, I would say one of the key things to take away is that advocacy works, and that building political will and public support is essential in pursuing epidemic preparedness funding, whether it is received through donors or a national budget, that it's critical for there to be the country ownership and implementation and use of the funds in a structured way through the national action plans. So I guess my overall message is just that bringing the public and the political awareness into the equation at the national level and state level is key, and it will inform and benefit the global efforts as well.
Absolutely, both of you said that beautifully. Dr. Emmanuel.
Thank you. One very key thing I want to emphasize today is the need to work with the various stakeholders, both health sector officials and non-health sector officials, because they're all critical in ensuring that we succeed in our advocacy efforts.
Thank you. And lastly, Dr. Gafar, one thing you'd like the audience to leave with today?
Okay, thank you very much, Mena. In addition to what have been said earlier on, I think raising the accountability bar is going to be very, very critical to ensure that we raise the accountability bar for the responsiveness of the political class, for effective utilization of resources, to ensure that we get the needed result, and raising the accountability bar to ensure that all the stakeholders were able to hold them accountable for their roles and responsibilities, so that collectively we're going to have improve more results with synergy. Thank you.
Thank you so much. All beautiful takeaways in terms of just the overall importance of advocacy for this issue, building those partnerships, having that funding dedicated, informing stakeholders, all important elements. I'd like to thank our guests for joining us today and sharing their experiences and stories and insights in this episode of Advocacy in Action. I learned a lot, and I hope everyone else will also learned a lot. I also like to thank all of our listeners for tuning in. So you can find more information about future episodes by following the Global Health Advocacy Incubator on Twitter at incubator_GHEI, and on our website at advocacyincubator.org. I'd just like to thank all of our speakers one more time before we totally wrap up, and thank everyone else for coming. We hope you continue to join us as we continue to explore what's working, what's not, and what's coming next for global health advocacy. I'll talk to you all soon.
Thank you so much.
Thank you.
Thank you. Thank you, Mena.
Thank you.
Thank you, everyone.